My name's Delves Yates and I have been a nurse. I was working this out the other day and I have been a nurse now for 28 years, which is scary. And I'm now a nursing lecturer. And I suppose one of my many passions is to support nursing students so they really understand the most important things about looking after patients. It's been a long-held annoyance, to be quite honest, that I couldn't find a textbook that I thought gave nursing students a really good start with their programme. There were quite a lot that were out there, but nothing was something that a first-year nursing student could use as core material that they could just keep dipping in and dipping out of. So after having looked at loads and loads of different textbooks and stuff, I just thought, well, actually, you need to get involved with doing something, so there is one that's there. So that's really how the book came about. The main types of different people were those that were contributing, and on the whole, most of them were either practicing nurses or lecturers, or both. Some good combinations of both, actually, in the chapters. And then for me, probably the most important people that added a lot to the book were the students and the patients, who gave us, snippets of their experiences or just gave us hints and tips and comments on things that they had found that were really good and things that perhaps could be improved, just to really make the book useful for somebody to understand, other people's experiences, and your experiences are often very similar to other people's experience. Students tend to be worried about the same things. So it's really nice to see, how somebody else has dealt with something that's been really stressful. I think what is going to make the book really useful to the students is actually, for a start, having something that they can tote around with them and dip into and read little sections. I really like all the different case studies in there, because I think quite often it's difficult to remember things unless you can relate them to patients. So that will really help in relating things to patients. Lots of different activities that will get you to just start thinking about the material that you're actually learning about in class. And then questions and, reflections on things. So hopefully it will be something that not only you can sit and read, but you can really engage with and expand your knowledge through. I think for lecturers, what will really help them teaching with the book is the exercises and the case studies, because it's really good to go to class with things that students can discuss with each other and really use to get to grips with the subjects. I think that the clinical skills protocols in the skills section will be really, really useful, because that will be the sort of thing that you can use with students and talk about how you might adapt those skills to different situations. I think once again, sort of like the exercises and the quizzes and bits and bobs. But I think as well, for me as a lecturer, I really like the going further section, because it gives you a good idea of articles that people who are subject specialists have thought are really good reading, that you can set the students for, reading after class and, commenting on next time you get together. There are lots of features in the book that get me really excited. I think one of the features of the book that's really important is the fact that it's very patient-centred. So everything relates back to patients. But another of the features that I am really excited about is the interactive nature. Within the eBook, you can actually click on a whole load of different links to understand the subjects that are being discussed even more fully. I think the framework of the book, the Understand, Apply, Go Further and Revise framework, is just a really intuitive framework that you actually get led step by step to a point where you will have an excellent understanding of the material, which is really important when you're looking after patients, because they're never the same. So you may be able to understand a topic, but you need to be able to apply it sometimes in really different ways. And if you use that framework of stepping through that, so if you get a good understanding of something and then can apply it to patients when you're out in practice, and then by reading the go further bits, you can really make sure that you can apply that to any patient situation. And then I sort of think, in a way, you pretty much have done the revision bit too, because if you understand something, you don't necessarily just need to memorise the facts.